Hello and welcome to the Société Santé en Français webinar. My name is Nathalie Boivin. I'm the Communications and Knowledge Broker Officer at the Société Santé en Français. It will be a pleasure to be your host for this webinar. Today's webinar is the first of a Winter-Spring 2020 series. We have two types of webinars. The first one is Professional Development Series. The second one is a Discovery series. Today's webinar is part of the Discovery series. For a little overview of Société Santé en Français, first a little overview of Société Santé en Français, our webinars. Société Santé en Français is a national group of 16 provincial, territorial, and regional networks that are committed to improving the health of all francophones and Acadians living in minority communities in Canada through greater access to quality healthcare services in their language. Webinar objectives are as follows. First, improve access to new information. Second, facilitate evidence-based decision-making. And thirdly, foster interactions between information providers and users. Today's webinar presents the result of a study that empowered managers to implement active offer of French language service actions in a hospital in a geographical region with a low French-speaking population. The presenters will review the challenges and facilitators encountered during this implementation and will discuss the positive influence of a collaboration with a regional partner that resulted in the implementation of similar actions in a second organization. The webinar will be in three parts. First, introduction to each of our guest speakers. Second, presentation by our guest speakers. And finally, a question and comment period for which we will have 10 to 15 minutes at the end of the presentation. Our first guest speaker today is Dr. Catherine Sauvé-Schenck. She's an assistant professor at the School of Rehabilitation Sciences at the University of Ottawa, a research member of the GReFoPS, which is the Groupe de recherche sur la formation et les pratiques en santé et en services social en contexte francophone minoritaire. She's also a member of the Institut du Savoir Montfort at Montfort Hospital. Dr. Catherine Sauvé-Schenck research program seeks to improve our understanding of the influence of the social determinants of health on the rehabilitation of people living with a chronic condition. As well, Dr. Sauvé-Schenck aims to identify and implement solutions in clinical practice to address the health inequalities the people living with chronic conditions are facing. Dr. Sauvé-Schenck's research interest focuses on the social determinants of health, particularly income, housing, and belonging to an official language minority community. Our second guest speaker is Dr. Jacinthe Savard. Jacinthe Savard is an associate professor at the School of Rehabilitation Sciences at the University of Ottawa. She's a research member of the GReFoPS and of the Institut du Savoir Montfort at Montfort Hospital. Since 2010, her research focuses on the training of health professionals and access to health and social services in French for francophone and Acadian linguistic minority groups. In collaboration with Sébastien Savard and Marie Drolet, Dr. Savard completed numerous studies on the trajectories of services for the francophone and Acadian linguistic minority groups and the factors enabling the continuity of services provided in French. Dr. Jacinthe Savard has integrated the training on active offer of services in French in the academic program of students in the School of Rehabilitation Sciences at the University of Ottawa. She collaborated in the production of a collective work published in French and English entitled Accessibility and Active Offer, Healthcare and Social Services in Linguistic Minority Communities. So, without further ado, I will pass this over to our guest speakers, Dr. Sauvé-Schenck and Dr. Savard. Welcome.
Thank you, Nathalie. Catherine, you'll share the screen.
I am, and I'm seeing some chat on the side about it. If people don't see the screen, just let us know the slides.
Okay. So now I guess that I do see your screen, so I guess that our participant can see it also. So first I want to acknowledge that this project involved also two other researchers from the Institut Savoir Montfort, Dr. Denis Prudhomme and Dr. François Durand. And the project also received financial support from the Société Santé en Français, which itself is funded by Health Canada. Before we continue, we would like to have a sense of who are our participants. So we have two pool questions that we will share with you.
Mon Dieu, le cerveau me fonctionne en anglais.
You can choose to, like, there's no obligation to answer the question. It's voluntary and it's anonymous. We don't have any mean of knowing who answer what. But it's just to, you should see the question on your screen now. So if you want to answer, we'll have a sense of who is our audience.
Okay. Question 2, 9, 27, 18, 45.
Nathalie and Sirivan, I think your microphone is still on. So Jacinthe, do you see the survey on your screen?
Yes, I do. So I see that 13 participants have voted. We'll maybe give a few seconds more and then continue. Okay, so we'll go on. You can stop the pool and we'll, yeah. Okay, so you want to share the results? So everyone can see that we have a bit more of participants who are first language French and work in English mainly, in organizations that provide English mainly services. Okay, so stop the sharing of the results, not of the screen. Okay, and how do you disappear that so that people can see only the, because now we see the results of the survey.
Sorry, it's our first time for trying to do this.
Est-ce que si tu le baisses, if you just like lower the screen, does it work?
Oh, I don't see them anymore.
Okay, I see them. Okay, so I just show, okay, I just lowered them on my screen, on my own screen. Sorry about that. So our plan today is to briefly discuss the impact of language on health, describe the linguistic context of Ontario and of the region where the project took place. And then we'll present a summary of the results of an implementation research project. And more specifically, We'll talk about the barriers and facilitators to implementation of actions to increase active offer of French language services. And we'll talk about collaboration with regional partners. So starting with the impact of language on health, the literature has shown that language barriers can influence the safety of patients and the quality of services received in various ways. It can increase the risk of diagnosis errors, reduce the understanding of care directives, which itself can lead to difficulty following recommendations or medication prescriptions. It may also cause difficulty with trust building, and it can people can tend to delay non-urgent care until the situation has worsened, and it may be harder to treat. Now, we'll look at the linguistic context. At the federal level, since 1969, we have the Official Language Act that recognizes the equal status of French and English in this country and allows or guarantee that services provided by the federal government can be accessed in both official languages. And we also have the Canadian Charter of Rights and Freedoms that protects the rights of individuals living in official language minority community, whether English or French. However, healthcare is a domain of provincial jurisdiction. So the Ontario linguistic laws and policy apply to healthcare in this province. In Ontario, we have the French Language Service Act that confers the right to members of the public to receive government services in French in 26 designated regions of the province, where 80% of the francophone population in Ontario lives. But health and social services are not direct government services. So the obligation to offer services in French does not apply automatically to those services. Rather, the Healthcare and Social Service Organization can request a designation, and once designated, they must respect many criteria that aim to ensure the provision of French language services. Traditionally, this designation has been voluntary, but in most recent years, the government has created the French language health planning entities to work with the local health integration network to identify the needs and priority of the francophone population. And in this process, the LIN can recommend that some health service providers work towards designation to increase the comprehensiveness of French language services in their region. Now, as many of you know, there are many changes taking place in Ontario right now to reorganize the healthcare system, and the LIN will be transformed into another structure. But the French language health planning entities were informed that they will remain after the restructuration. Another important information about the linguistic context is the number of French speakers. In Ontario, people who have French as mother tongue or as first spoken language, official language, compose 4 or 4.1% of the population. Although it's a low percentage, in absolute numbers, Ontario has the highest number of francophones outside Quebec. Now, what do we know about the situation of those francophones living outside Quebec regarding healthcare access? The literature tells us that, in general, healthcare professionals tend to overestimate their clients' ability to master their second language, in particular, reading abilities. And from the survey on vitality of linguistic minority communities, we know that 75% of francophones living in a linguistic minority situation consider it important to receive their health care and social services in French. However, only 40% had used services in French at the moment of that study. And this is true even for bilingual persons. One cannot assume that they can express themselves at the same level in both languages. they are generally more comfortable and have a higher language proficiency in one of the two languages they speak. Another fact that is also important is that in general, Francophones living in a minority context have a tendency not to request services in French. And this may be because they are convinced that the service does not exist or that it will be delayed and they're not willing to wait for services in French. So one of the strategies to increase access to the preferred language is the strategy of active offer. And now there are two other pool questions that are about active offer. So have you heard before this presentation about active offer, and has your organization worked towards it? Oh, that's 1 and 2 again. Can we go to 3 and 4?
I moved it down. Do you see 3 and 4 now?
Yeah. Or if it doesn't work, we'll just skip them.
So in the audience, you can choose, you can answer 3 and 4 if you'd like. Again, it's anonymous. It's just to have an idea of who's...
Okay, so we have to move it ourselves on our screen, right? 3 and 4, okay.
Yes. Yeah, if you scroll down as the audience, you can see the questions 3 and 4 for answering. And you can also move the window from the poll across your screen so that it's not in Jacinthe's face if you like, or my face. So we see an interesting trend that quite a few of you have heard of active offer before, and a lot of you have organizations where there's been some actions of active offer already.
About 1/3 are contemplating, but not yet. Not done yet.
Super. I'll go back to the
slides. So simply define, active offer is an open and explicit invitation to members of the public. Okay, so you're sharing the results. Okay, so you can see, yeah, you have to scroll down to see them. Yeah, it's like you said about, most of you have heard about the active offer, and about 1/3 are still contemplating actions. So active offer, simply defined, is an open and explicit invitation to members of the public to use one of the two official languages. And examples of action could be to greet patients in both French and English, or to display posters that indicate that services are available in both languages, or many other things, but we wanted to give only a few examples. And to increase active offer of services in both official languages, actions must be taken at various levels of the system. In one of our previous research with the Francophone students and healthcare professionals, we saw that the stronger determinants of individual behaviors of active offer during the encounter with a user was the support from their organization. Students and professionals that did not feel their organization valued offering services in French were less prone to offer those services to clients, even if they could do it. Hence, we thought that if managers were more aware of the importance of receiving services in one's more proficient language, as well as if they were more aware about the non-always revealed linguistic capacity of their healthcare providers working in their unit, it could be one of the lever that we could use to increase active offer. And that's how we conceived that project at the beginning. We thought we recruited 3 organizations with various levels of French-speaking clients and language capacity in their human resources. And wanted to see if we train the manager, we sensitize them about all the issues and about like the small actions that can be taken to increase active offer. Maybe they will, after that, be able to do some actions to make better use of their human resources and other resources that they have to provide services in French. Unfortunately, due to unexpected reorganizations, two organizations had to decline participation. So only one was left to participate, and it was one with a low proportion of French speakers and low proportion of French speakers among their clients and among their human resources. So the results that Katrina will now present are for this specific situation. Catherine.
Merci. Just to warn you, there's renovations in the area of my office, and so I put the mute on because they were starting to drill the ground somewhere nearby. So hopefully that won't disturb the sound and you'll still be able to hear me all right. So the project was carried out in Ontario, and I hear that several of you today may not be from Ontario, so we thought it might be interesting to show you a map of us. So with one of the red arrows is where we are in Ottawa, and the site that agreed to participate was in Thunder Bay. And just to give you an idea of distance, it would be a 4-hour flight because you have to go via Toronto. And if you were going to drive to Thunder Bay, it's about 16 to 18 hours, depending on the weather. So we were quite far from the site of the project. We just wanted to point that out to you. So Thunder Bay is in Northwestern Ontario, and there's a relatively small percentage of people who identify as French speakers, so about 3% of the population of the entire region, and the region is very large. And of course, the French-speaking population is not evenly distributed across this region. So there's some pockets, some towns that have a higher percentage of French speakers around the area, especially of Thunder Bay. And the site that agreed to work with us is an acute care hospital, and it's a regional hospital. So they do serve these smaller populations where a lot of French people may travel to Thunder Bay for some services if they're not already living in town. So the Regional Health Sciences Center has been identified to provide services to the French speakers of the entire region. And they're working towards a designation, as Jacinthe explained what a designation is, so that, you know, if they were designated, then they would be the people that are serving in particular the French population. Now, because of the geographical distance, it was very important for us as the researchers coming from Ottawa to have contacts within the site. And of course, in particular, when you're doing research and you're from sort of the academic world, it's very, very important that you have some locals who work in the organization, who know it very well, who know the people, the staff, and who know how the organization works, because that just makes, when we want to do change, it just makes it that much easier and that much more adapted to the place where you are. So we had 2 upper level managers and an administrative assistant who volunteered to be our local coordinators. And they were very, very helpful. So our project, we wanted to better understand the perspective and all the challenges. So from the point of view of the unit managers, when they're trying to make change and they're trying to implement actions of active offer, you know, what's difficult, what's easy, what are the bumps that you might encounter. So the way that we did the project, we recruited unit managers. So sort of like the manager that works directly with the staff providing services to the patients. And 4 units worked with us. And the first thing that we did is that we took the managers in to do, it was about a half-day workshop. And during the workshop, we talked a lot about language and health. What's the relationship between those 2 things? We also talked about official languages and official language minority communities and what's the difference with those population groups, how are they experiencing health and access to services. And then, because the whole point, of course, was to implement actions of active offer, we gave them a list, and it had all kinds of ideas of what kinds of actions could your unit take in terms of active offer. So Jacinthe had given 2 examples. So for example, greeting all patients in French and English, or making signs that say, you know, you can have a service in French here. So we gave them a list of all kinds of ideas, small actions that they could do, and we gave it to them. And then those 4 managers met with the local coordinators, and together they looked at all the actions. They looked at what would be 4, so the goal was to find 4 simple but feasible actions. So what did they think they could do? What was possible in their environment? So then they chose the 4, they adapted it to how their hospital worked, and then they went through the implementation of them, so putting them in place, these changes. Now I'll show you what the 4 actions were that they chose. So they chose to change the voicemail greetings, or the messages when you phone in to the unit, to make sure that if you left a message, it could be done in French and English. They also made sure that every sign and every notice that was on a unit was in both French and English. So from the smaller signs to the very big signs that they had. They also looked at who on their units could provide services in French. And then they gave those individuals pins that they could wear that said "Je parle en français." And they also went through all the units' educational resources and information forms and made sure that they were in both French and English. Something that's important to understand, though, is that not all of these actions could be done on each and every one of the units, because there were some units where there was just no access from the public to a voicemail service that just didn't exist on the unit. So not every one of these things was done on the unit, depending on just the context. The other thing that was interesting is that all of these actions, all 4 of them, required some support or some assistance from another service. So it wasn't something that just the unit managers could just do on their own or implement on their own. And what I mean by that is that, for example, changing a voicemail in their institution, you really needed to contact the IT department. And they needed, for example, also the help of a translator to make sure that the French and the English on the educational resources were good. So the local coordinators were very, very important for all of that, because they're the ones who made the links between the services and the units. What was very interesting as well is that we came into this project with the local coordinators thinking that we were really going to try and empower the unit managers and inspire them to take on the actions of active offer and all the implementation of this. But what we ended up doing was empowering and inspiring the local coordinators. So what they did is that they initiated and implemented 2 additional actions that were outside of the scope of the project, but we think it's very important to tell you about them because they were very good actions. And again, they were just spontaneously implemented by the local coordinators. So the first one was that they decided that, well, you know, maybe at all the points of access in the hospital, it might be good to have a little sign that says "Bonjour, welcome." And on the back of this sign would be instructions. So if the staff member who's at that desk does not speak French, well, that's okay, because the person coming in can say, "Oh, I'd like my service in French." And the staff person can read the instructions and know what to do next, how to better support this person. We do know from the site that this action is currently on hold. They were revamping it a few months ago, so we're not exactly sure where they are at, but it may still be, it might be revamped and back to being implemented at this time, but it has been on hold, this one. The other action that they initiated was in this regional health hospital, when somebody's going to have a procedure such as a surgery, the hospital sends out letters, and the instructions in the letter are all in English, but it tells the person things like, you know, take this medication or stop taking this medication before you come in for your surgery, and has other instructions for the patient. But these have traditionally only been in English, and the local coordinators organized that they added a line in French, so a sentence that said, you know, if you need to have this instruction in French, or if you have any questions that you want to be answered in French, please call this phone number. So this action was especially important because it helped the hospital identify who might need extra language support. And in a population where you don't have a lot of French language speakers and you also don't have a lot of French language staff, it's particularly important to really be able to find those people who need the support. So implementation of the 4 actions was a big success. They were all implemented and they all survived the first month after being implemented into the normal routine. But there were, of course, some challenges that were identified along the way. And the way we found what these challenges were is because it is a research project. We did do some data collection, you know, at different levels, you know, with the patients, with the staff, and with the unit managers to try and see, you know, what was going on, how easy was this. And the most important challenge that we found was that in general, the staff didn't have a very strong conviction that active offer was very important. And this, it needs to be taken in light of the real context of the work of these people in a hospital where there's rival daily priorities, right? So every day they have to manage beds, they have to manage people who are ill, they have to, there's staff to be managed, so that the language component takes oftentimes maybe a less importance. And the other thing is that considering the low percentage of French speakers in the entire region and the fact that Northwestern Ontario has a lot of other language groups who are quite important in numbers, and here we're talking about sort of the indigenous languages, Italian and Finnish, those are big culture groups that are in the area. The staff had questions as to whether or not the Francophones had a bigger need, or how important were the needs of the French speakers compared to all of these other groups. So that was a bit of a challenge. Now, there were several facilitators because, again, this was successful. One of the facilitators, so Jacinthe mentioned that organizational support is very important when we're talking about implementing active offer or actions of active offer. And in the situation where we were at in Thunder Bay, the organizational support was phenomenal, and so it was very present, and we really felt that they wanted this project to work. I think they saw it as a way forward to really help with patient care, to improve patient care. The other very big facilitator was the involvement of the local coordinators, that they were there to support us, but also to support the managers and all the staff that were trying to implement the actions, and really making sure that it responded to the needs, the local needs of the area. Something else that came up was the fact that this was really a project, so that it was defined in time. So we weren't coming in to do a complete upheaval of how things were being done already in the hospital. So it helped with the buy-in. So people were, we think, probably more likely to go through with the actions because they saw that it was defined in time. We were only asking for 4 things, and the managers had a choice in terms of what was going to be done on their units. So that was very helpful. Now, when we go through the effort of trying to implement change, it's really important to look at sustainability, so that, once you put in the action, we want it to stay for at least a few months or years if possible. So challenges to make active offer actions stick around for a while. The ones that we identified, there were 2 of them. The first one was that there's a limited number of staff who could provide French language services. So that really limits or could limit how long an action could stick around. So if you're saying we can offer a service in French, but there's no staff to back it up or to help you with that, then actions may not last a very long time in an organization. And the other one is if staff don't really believe that active offer is important in the context of their work. But things that really do help, the first one is that if the actions are not dependent on the staff. So that was very interesting in this project in particular, that the 4 actions that were chosen, they're not dependent on staff members. So that means that even if there's a high turnaround of people on a unit or the manager changes, if you've changed the voicemail, it won't need to go back to only being in English after a manager leaves or staff members change. Or if the educational resources are bilingual and all of the staff changes, it can remain there as a bilingual resource. It doesn't need to, so it's not dependent. I'm hoping I explained that well. The other thing that really helps with sustainability is if the actions become permanent processes, right? So they're more likely to stick over years. And that's exactly what actually happened in the Regional Health Center in Thunder Bay, is that 3 of the actions of active offer became permanent hospital processes. So the 3 that are remained now are the information being translated bilingually, so all the paper resources, the educational materials, the signs, and the voicemail continue to be bilingual. And the reason these things have become permanent hospital processes is because it's really the local coordinators who took that upon themselves to make sure that happened. So it had nothing to do with actually the research project or our involvement. They really took ownership of this project and went through with that. Now, there was a very interesting positive effect of the project, and it was unplanned. So we as the research team didn't plan this to happen, but it's how the success of our first site, how the good news of that and the success just spread within the city. I shouldn't actually, well, spread, they shared it and somebody else did the uptake of it. So Thunder Bay, what happened is that the Regional Health Sciences Center did a presentation. And this presentation was in the context of a sort of like a conference with healthcare providers from the region. And it's the Local Health Integrative Network that organized it, so the LIN. So they're the people, as Jacinthe explained, who sort of make sure that, you know, the needs of the region are met. And so they organize this little conference, they invite all the healthcare providers. The hospital that participated in the project talks to everybody about the research they participated in and how there was a lot of success. And this really inspired the providers in the room, but also Le Réseau du Mieux-être, and that is a planning entity. So that was from the slide that Jacinthe presented. So this planning entity thought, well, maybe we can support another site to replicate this same experience. And that's exactly what happened. So from the sharing of the success in one site, we then have the same type of project being shared in another side of the city, so that we have now active offer actions in 2 places. And what's important about this collaboration is that these 2 sites are living in a similar linguistic context. So they both have the same challenges and facilitators, right? Because there's not a lot of francophone speakers in the region. And also the number of French-speaking staff is also very limited. So they were able to, you know, collaborate on understanding the challenges and the facilitators that they may both be living through. So what can we learn from all of this? So the first thing is that collaboration and partnerships can be important in helping to spread success with implementation of active offer. So sharing ideas and sharing particular ways or similar ways that actions can be implemented in a region that has not too many people who speak French, for example. And also, if you're looking to implement actions in your organizations, it's good to start very small actions that can have a big impact, and really looking at the feasibility and giving choice to those who need to have the buy-in for implementation. And in terms of the research project, what we found was also that in a context where there are only a few people who speak French in your region, it's important to find ways to identify which patients will need the support in terms of language. And this is our final slide. And so, again, the people that we'd like to thank, so it's Société de Santé en Français, l'Institut de Savoir Montfort, Thunder Bay Regional Health Sciences Center, and Le Réseau du Mieux-être. So I think I stopped the share at this point. Oh, sorry, I see that somebody said, I missed the second challenge to sustainability. Could you kindly repeat? Can I just answer that question before we go further?
Yeah, you may go ahead.
So the two challenges were, I can even go back to that for the person who missed it. So sustainability was affected by the number of staff who could provide French language services. And the second one was when the belief, when you don't feel, you're not so convinced that active offer is important, then sustainability of something you've implemented may not, the actions may not last very long in time. So I hope that that answered that question.
OK, maintenant, ça va être à mon tour de... Merci beaucoup. Oh, I'm sorry. Oh, my brain. I'm sorry. Thank you for this most interesting presentation, Dr. Sauvé-Schenck and Dr. Savard. Now, this is the time to hear from you. So, to participate during the question and answer period, please use the chat box that is at the bottom of your screen. You can, your screen, I'm sorry, you can either write a question that you might have for our presenters, or if you feel like speaking up, or I'm sorry, just to ask your question personally, you can definitely do that, and we will open your microphone. I see there is a question from Jenna Webb. And she is asking, were there specific actions you took to overcome the distance between yourself and the test site?
You want me to answer, Jacinthe? Jacinthe and I are in two different rooms, so we can't actually...
Go ahead, Catherine.
Yes, there were some things that we did. There was a lot of communication between ourselves and the local coordinators over telephone, by email, and we did a lot of site visits. So either as a team with 3 members of the team, or at the time I was the research coordinator, so I would often go on my own to Thunder Bay to see how things were going and to help problem solve any bumps in the road that were happening.
Thank you very much. Thank you very much for this question. Now, for the participants that might that are online, I do have a question for you. Oops, something came up from Danielle Filion. She's asking, what are the most effective or compelling arguments to present in order to address the question of belief in the importance of FLS, which is probably French language services? Ladies?
Yes, I think that when we can link the lack of services in French to a security question, this is the most powerful argument. We don't have a lot of data on the link between safety and language, but we do have some. In the report from Bowen, there is a lot of information that is coming from the United States, but we do start to have some information from Canada. We have some information, we have the testimonies, for example, on the CNFS website, the one from Mona Mercier, who said that when she had a stroke, she wanted to say la tête va m'exploser, and she was not able to say that. She just said, I have a headache, and then she was answered by the nurse, you don't come to emergency for a headache. So hopefully, not hopefully, but thankfully, they did more tested because she was doing a stroke. But when I was bringing this example to managers in the different research project that I did, they say, oh, I see now that it's a safety question. So I think this is a powerful argument, and we do have some. These are more testimonies that we have on the CNFS website, but I know that at the Institut Savoir Montfort, Dr. Denis Prudhomme is working with the data from Canadian Institute of Health Information on undesirable events and try to link language and the happening of undesirable events. And we'll have more data later on that are quantitative to support this argument also.
Thank you very much, Dr. Savard. We have another question from a participant. She's wondering, this participant is wondering if it would be possible to have the list of the active offer actions that were proposed to the hospital, and so to share for today's participants.
Yes, I guess we could add that to the PowerPoint. We can add a slide on that. Because I know that our slides will be posted on the SSF platform.
Yes, all of the today's webinar as well as the PowerPoint presentation will be available through the website of Société Santé en Français. So yes, you will be able to listen to the webinar again and to as well read the PowerPoint. Another participant was asking, what were some of the other actions that were proposed to the first site that you worked with for this research, the pilot project?
I can try to find the list really quickly on my computer.
I know the list was inspired by our questionnaire that we did for healthcare providers. We have a questionnaire that we developed where healthcare providers can self-assess what they are doing. So actions on that questionnaire include, like, I greet clients in both languages, I sign my emails in both languages, I do have access to tests in French, or things like this. So they were inspired by this questionnaire. They might have been changed a little bit to be more organizational actions than individual actions for that project.
Thank you. We have lots of questions today. This is exciting. One more question we have is the following. One of the challenges and one of the remaining challenges is to convince staff members that providing French language offer. What is the argumentation to convince them that French language has the priority compared with or compared to other languages, such as native, Italian, Chinese, and so on and so forth? Mm-hmm. Ladies?
Well, I think, I'm not sure what Jacinthe would say.
Go ahead, I can complete.
One of the differences is the legalities in terms of the official languages. And that's the biggest argument in terms of the, in terms of that, really.
The other argument is that we tell them, like, start with French because this is an obligation with the French Language Act, but then you can use some of these actions to inspire you to better accommodate your other language groups. Mm-hmm.
Yeah, once you've started with one group, you can probably do a little bit more for others, in particular about asking people their preference for language. Mm-hmm. If you already ask if they would, prefer one or the other language, and then they say, well, no, actually, I'd prefer to speak Mandarin, you're already further ahead than not asking at all.
Mm-hmm. And then you can start identifying the linguistic capabilities of your human resources. If you have a big group of clients speaking one language, there is chances that you have also higher numbers of healthcare professionals able to speak that language, because usually if the language is prevalent in a region, it will be also in the care providers.
Mm-hmm. Mm-hmm. And of course, there's the whole argument that Jacinthe was saying about the safety and security. It's for everybody who doesn't speak the language of the provider. So there's a huge argument to at least start with one.
Yeah. And yeah, of course, you cannot have healthcare providers who speaks all the languages that are spoken in Canada right now, because there is too many, but there are interpretation services, professional interpretation services that are available. So once you're you're conscious, or you're aware, once you're aware of the link between language and safety, you'll be more attentive to all those needs, and if you don't have the resources to provide the services in your own organization, you can start looking at using more the interpretation services. Of course, it's better to have the healthcare professionals who speaks the same language that the users, but it's not always possible. So when it's not possible, the professional interpretation service is also a solution.
Mm-hmm.
Mm-hmm. And we have one more person saying, so we could imagine expanding the active offer to other languages, I guess, depending on the feasibility.
Yeah.
Mm-hmm. All right. And I do have one question for the participants, if anybody is willing to answer it or feels. My question was as follows: what element presented by our guest speakers today inspire you to implement the active offer of French services in your agency? What would it be? Waiting for an answer, maybe I could have a question for our guest presenters. I'm sorry, I could have another question for the presenters this time, or our guest speakers. You did mention a few things that were sort of came as a surprise for you. What element surprised you the most during the implementation of your pilot project, either Dr. Savard or Dr. Sauvé-Schenck?
I think I was surprised it worked well because I don't know, there were so few needs identified by the staff that I thought, you know, that they would be reluctant to do so. But I guess because of the high level administration, very strong support, they did follow through and they did implement some action. So I guess after the first meeting, when I saw they were so low convinced about the need of active offer, I'm surprised that they continued with the project.
Mm-hmm. But I think it was, for me, it's along the same lines, is that the conviction for the French was maybe low, but there was high conviction that patient care was so important, and that was so important to everybody. So I think that's what carried the whole project. And the fact that the local coordinators really took it to heart, the project. They took like ownership of it, so that it became its own thing. I think that was really surprising, but very lovely.
Right.
And I can add to that the local coordinator, Katrina, said that there were two high-level managers, but one was the director of patient care quality. So the quality of care for our patient care was such a high-level value in that organization for everyone, and she was the director of quality of care, it did help.
Mm-hmm. Mm-hmm.
Thank you. And in terms of the participants, some of you participants answered the question that I have for you, which was what element presented by our guest speakers inspire you to implement the active offer of French services in your agency? And the answers provided are as follow. The voicemail greetings in French was inspiring for you participants today. As well, we have another participant who said the sign with the next steps on the back of it is really cool. Another participant is sharing the following: the simplicity and impact of the actions is inspiring. So thank you very much for your feedback as to what element inspires you the most to implementation of active offer. If I may, I would have an extra question for our guest speaker. What advice would you provide to an organization willing to initiate active offer of French services?
Well, I would say start with small steps and with things that are feasible. Like look at what you have already, look at your resources. What can you do to have a better use of your already existing resources? Because often the first reaction when we talk about French language services is we cannot do it because we don't have enough providers that can speak French. But there is other little actions that can be done to use your resources in a most effective way. The letter with the sentences in French was a way to really, they have identified during that project, the secretary of the director of quality care was French speaking. So they gave her the title of the French speaker, the francophone coordinator or French services coordinator. And she was the one that people had to call if they wanted information in French about the letter that they received. So they made a very high use of one resources that could speak French that was not used for that before. So I think making better use of your resources, like looking at your local context, what you have, what's simple, what's feasible, is the best advice.
And while giving choice too, like not necessarily imposing, but you have to figure out who needs to help you out with this and make sure that they have some buy-in because they have some choice in terms of what they think will be doable as well.
All right, and I'm just present the show. You can see on your screens there will be for more spring webinars and upcoming activities. So you can go to either info à santé en français and see the program online or the following website. As well, if you want to view previous webinars, you can also go to the Société Santé en français website or visit our portail Savoir Santé en français. Today's webinars recording will be available 1 week from now. And as well, the PowerPoint presentation that was shared by our guest speakers today will also be available 1 week from now. We are going, oops, I've got a few other comments maybe that I will share with you where somebody's saying we are going through a lot of budget constraints. Would you please share any advice on how to deal with this issue?
Start small.
Of course, when you're going through budget cuts, there is other preoccupations that the staff have. So maybe like you have to wait until not the cuts are gone because they won't go away, but until it's like the climate has settled down a little bit to start a new project. But then you start small and start like with the resources you already have in place.
And simple things to implement, not the actions that will take 3 months, but look at things that you can sort of change with a few people, but not too much, time and resource. But we'll send the list along because I think that might be helpful for people to visualize what might be possible.
Yeah.
All right. And another participant is asking where and when the deck slides will be available. So as I was just sharing previously, 1 week from now through Société Santé en Français website and Portail Santé, you will be able to access the PowerPoint presentation, the deck of slides, today's decks of slides, and as well you will be able to listen to today's webinar. We're also sending you through the chat box the link for the survey. So following today's presentation, we would really appreciate you filling in the survey. So it helps us to provide the feedback to our guest speakers and as well provide us with some ideas as to what kind of webinars and what topics for webinars for the following the webinars coming up, or maybe next season for fall 2020. It is now time to say goodbye. Thank you to our guest speakers, Dr. Savard and Dr. Sauvé-Cheng, for this very interesting and inspiring presentation. And thank you all for your participation today. I am Nathalie Boivin, and I wish you a very happy rest of the week. Bye-bye.
Thank you.
Bye. Thank you all.